Hi, I'm Dr. Nazeer Ahmad, physician and diabetologist practicing at Dr. Nazeer's Diabetes Center, Puttur, Karnataka. Today, I'll be speaking a few minutes regarding hypertension, what exactly is hypertension, and what are the complications if it is not controlled properly, and how do we control hypertension, and ultimately, how we can have a healthy and normal life. Coming to what is hypertension, whenever our heart beats, the blood gets circulated throughout our body through a lot of blood vessels. There are different sizes of blood vessels. And during the circulation, the blood exerts some pressure on the walls of the blood vessels. That is the pressure that is called blood pressure. So when we measure blood pressure, there are two components: systolic blood pressure and diastolic blood pressure. What exactly is systolic? And some people, when we tell them, inform, check your blood pressure and inform, they call and tell my blood pressure is 150. So just because they don't know what exactly is how do we read blood pressure and how do we record it. So there are two components: systolic blood pressure and diastolic. What is systolic blood pressure? That is the pressure exerted by the heart when heart is pumping. That is the systolic, when the heart contracts. So that is what is normal systolic blood pressure. It is 120, and it can vary a little. So 100 to 140, we can say, still it is normal. So what is diastolic blood pressure? When the heart relaxes during the heart contracting, relaxing, the relaxes, whatever pressure is there in the blood vessel, it's called diastolic blood pressure. So that what is normal? It is 80. So it can vary a little. It can be 60 also. It can be 90 in some patients. Suppose it is going, if the systolic is going above 140 and diastolic is going above 90, it's called hypertension. So now we know what is normal blood pressure. And how do we measure it? So we measure BP using sphygmomanometer. The instrument is called sphygmomanometer. And this is the traditional mercury. There are mercury sphygmomanometers. Now we have digital sphygmomanometers, the classical ones, and we have digital BP apparatus. So it is quite useful nowadays because even a common person can check his BP at home using these digital BP apparatuses. So we get different companies and the good qualities and in quite affordable price. Especially during this COVID and lockdown period, people could not go to clinic, and these digital BP apparatuses have become very useful, and it is a must for each and every person at home. So we learned about measuring hypertension and measuring the BP. Now, I told you what is hypertension. So whenever the systolic blood pressure is above 120, 140, and diastolic is above 90. So both are important. So if any one is one increases also, it is called hypertension. Depending on the level, like above 140 to 150 or 160, whether how high it is, we have different stages of hypertension. And coming to the causes, why somebody gets hypertension. So there are different causes. Some are like, one is age. Definitely, as a person ages, his arteries, the blood vessels become stiff and he can get hypertension. And gender, some studies say that men are more prone for hypertension. And some lifestyle habits, something like smoking, alcohol, lack of exercise, stress, one of the most important aspect nowadays, and some medications. These are some of the causes of hypertension, and there are some rare causes also, some endocrine causes we call. And obesity, definitely overweight. And definitely a person who is overweight is at high risk of getting hypertension. and lack of sleep. So there are so many important causes which we can reverse. And excess consumption of salt, that's another important cause that we can control it and we can reverse. And our diet, unhealthy diet. So we'll speak about healthy diet later. Definitely, it can lead to hypertension. Hypertension is one of the complication of poor unhealthy diet. There's a lot of other diseases as well. So how do we reduce the risk of hypertension? Prevention is better than cure. Definitely reducing all the risk factors. So we should have a healthy diet, as I told you. We should exercise regularly. That maintains our body weight and it reduces by itself. Exercise itself reduces the blood vessels. It relaxes it makes the heart stronger, relaxes the blood vessels, it reduces stress and a lot of benefits. So exercise, how do we exercise? Simple, daily around 45 minutes of walk or whichever form of exercise a person can just continuously do. It can be swimming, it can be cycling, it can be a game, or it can be household work. It can be just climbing stairs. If you are working in a third floor, instead of using lift, just climb stairs every day. And keep walking whenever you are free. Walk. When if you are talking over phone, keep walking. So at least count the steps. We have gadgets, watches, and our phone, and etc., which counts the steps. Count the steps. Increase the steps daily. So these are simple measures in a day-to-day. We need not take extra time for exercise. In your day-to-day, our day-to-day activities, we can include exercise as a part. So exercise. Healthy diet. What is healthy diet? Healthy diet is something, if you see the most recent guidelines, as we are having too much of sugar, too much of carbohydrates. So studies have found that eating too much of carbohydrate leads to a lot of complications. It increases the fat content of the body, it increases body weight, obesity, increases BP, a lot of endocrine problems, other hormonal issues, and diabetes, etc., etc. So reduce carbohydrate content in your diet, reduce unhealthy fat. When I say unhealthy fat, it includes vanaspati, refined oils, a lot of fried items. You can increase healthy fat. What is healthy fat? You can have healthy oils like coconut oil, olive oils, butter, ghee. You can have nuts which have healthy oils. You can eat egg and fish, etc., etc. Increase. There is something called DASH diet for hypertension. It's taken as a treatment for hypertension also. So it includes having a lot of vegetables. So vegetables is a must. Vegetables should be 50% of your each food. So 50% of your plate must be vegetables. Especially a lot of it should be raw vegetables as much as possible. Raw vegetables as salads, different vegetables, plus little of boiled and cooked vegetables. Let it be half of your every meal. And reduce salt content. Don't consume excess salt. Salt is must in your diet, but reduce excess salt. Adding extra salt in your curries and having pickle and papad kind of things, and a lot of fried items, a lot of junk foods, and certain things like bakery items, bread, biscuits. These have a lot of salt content. Only it will realize only if you read the label. So make a habit to read the food labels whenever you get a packet of food. So my sincere advice is avoid as much as possible processed foods. What is processed food? Something like biscuit or bakery items, and whichever comes in a packet, whichever comes with a barcode. So as much as possible, avoid. Try to eat a lot of natural foods. Instead of that, you can make a habit to eat nuts, raw nuts like pistachio or walnuts and almonds, cashew or groundnuts, little, and 5 to 10 in a day instead of chewing all these unhealthy junk foods. So make it a habit. So these are some healthy, some small changes in your diet, which will definitely make big difference. So reduce, as I told you, unhealthy fat, increase healthy fat, and so reduce carbohydrate. That means reduce your grains as much as possible. Don't eat too much of rice, too much of wheat, and when you eat a lot of vegetables and other healthy fat and protein, your carbohydrate content definitely comes down. And next step is stop smoking. If you are quit smoking, quit or reduce alcohol intake, reduce stress as much as possible. Yeah, stress, even the present lifestyle, which includes a lot of stress, right from childhood. The kids are stressed, the workers are stressed everywhere, especially after the COVID era. Now everything is, economically, everybody is stressed. So a lot of work pressure. So we should manage. The stress is there everywhere. If you are doing something, there is stress. So try to manage it. Use your own techniques. Some people, they know how to manage their stress. Some people have difficulty. Take advice. Get some counseling. Take advice from your friends. Practice some meditation. Have faith in God. So these are all some measures which we can reduce stress. Another important aspect is sleep. Sleep is a medicine. Sleep is a medicine. So we need, as humans, we need sleep every day, at least 7 hours of good quality night sleep. So all these are important. It's not like some part of the day you sleep, and so as much as possible, 7 hours of night sleep is must for a healthy life. So practice it. Sleep early, get up early. Early to bed, early to rise. These are not just sayings. They are important. We are off late. We are realizing these things and practice it. It needs a lot of practice and adjustments and changes in your lifestyle. Reduce the usage of gadgets, talking over phone, watching movies overnight and late nights, TVs, laptops, and all those things. Reduce the usage. After 8, make it a rule at home. No phones after 8. So these small measures definitely avoid or prevent getting hypertension. And if at all you are diagnosed with hypertension, you definitely reduce it without medications. Okay, so you have done all these things. Blood pressure is still high. Doctor says, no, it is not coming down. Okay, you need to start medications. Don't delay, because see, one of the reason why the hypertension is called a silent killer is the symptoms are not very definite, because it's not like if your BP is high, a person has to get headache and blurring of vision and breathlessness. These are all the symptoms of high BP, breathlessness or tiredness and all those things. Some people won't have anything routine. He comes for a fever, I check his BP, it is quite high. Then I'll tell him, come back again and recheck how it is high. So that's how we diagnose. Everybody won't come, I have headache, check my BP. Some people won't have symptoms. Some people get to know he has hypertension only when he gets some complications. He comes, his kidney creatinine is high, his kidney is damaged already. Then we find out why. Oh, he had hypertension. It is there since 3 years. We have so many patients like that, young people. So if your BP is high, make sure you change your lifestyle. Still, it is not coming down. You need to start on medication. So the doctor will tell you, you have to take medications. Don't delay. Many people often they do. Once I start, I have to continue. Let me, it becomes a habit. So let me avoid. Let me postpone. No, please. You don't. There is no point taking medication once you already have complication. What are the complications? We can have the target organ damage. What we say, we can have nephropathy. You can have kidney failure. You can have eye problems, retinopathies. You can have heart failure, heart attacks, myocardial infarction. You can have stroke. The worst part of hypertension, stroke. We see patients who are well controlled. They're on medication. They suddenly stop the medication for some reason, especially during this COVID time, and they don't get the medicine, or by negligence, they are like, okay, let me stop and see. Suddenly BP raises, they end up with the stroke. Okay, done. Many people after the stroke, many people won't recover. They might become bedridden. They have a massive intracranial bleed, brain hemorrhage. They may not recover after that. They might die because of that. So don't, just by not taking proper treatment, we should not get into these complications. So once doctor suggests you to take medications, take it regularly. Keep following up regularly whenever the doctor says. Nowadays, as I told you, you can monitor your BP at home also. It's quite simple, easy, reliable. Many people have doubt whether it is correct. So no, it is quite reliable. We have been using it since many years and it is quite normal, reliable. Keep measuring your BP. If you have doubt, go back to doctor and recheck. So once the doctor starts you on medication, there are different types of medications. The doctor will decide which is suitable for you. Start it. If it is not suiting you, go back. Don't just stop it. Go back and tell the doctor, this is not okay. He'll change. Keep monitoring. Keep following up. And it's not that once you start once you are on medication, you need to take it permanently. Sometimes it happens. You change your lifestyle so much, you lose weight. Okay, you lose 10 kgs, your BP drops, you stop the medication. So whatever lifestyle changes I told you, if you are doing it regular, you're sleeping well, you reduce your stress, and you stop smoking, you improved your diet, you lost weight, you are doing exercise regularly, definitely your BP will come down. We can stop medication also. So that you should remember. So this is regarding hypertension, and the more detailed discussion regarding each uh, uh, aspect of it is not in our time. The time doesn't permit for that in this session. So what we should understand is hypertension is a disease which can be prevented, which can be treated, and we can prevent the complications of it. Why people are getting complications? Because they are not aware of it and they don't regularly check their BP. Once they are diagnosed, they don't take proper measures, lifestyle changes, or they don't take proper medications. So a lot of people are ending up with complications like stroke, heart attack, kidney failure, loss of eyesight, etc., etc., stroke. So definitely, please, I request everyone to learn about hypertension. Check your BP at least once in 2 to 3 months. Keep a digital BP apparatus at home. If you think BP is high, please consult your doctor, follow the advice, and try to follow the lifestyle changes which I have suggested. And thank you for your kind listening, and wish everybody a healthy life, and thank you.